Good evening, ladies and gentlemen. On behalf of my colleagues in the organizing committee of the Dubai Pediatric Club, I would like to welcome all viewers from Dubai, UAE, GCC countries, and all countries around the world, especially from the United States of America. This webinar is CME accredited in collaboration with NMC Specialty Hospital Dubai, and it is organized by Now New Country Health UAE. I would like to thank
Dr.
the country
Saurabh,
business manager.
there is
Yes, the country business manager of this company, Mr. Tawfiq Ali. Today we have eminent speakers, Professor Nine Leving from United States of America and Dr. Wafa Helmi and Fiji Anthony from UAE. Well, there is a question for viewers. You have 5 minutes time. Tell us who are these scientists and pioneers. Well, welcome to Dubai, beautiful city. Those who have not seen, all are welcome to see this beautiful city. Members of Dubai Pediatric Club, on behalf of all of them, I would like to welcome all viewers once again. Well, the organizing committee of Dubai Pediatric Club, myself, Dr. Rajinder Joshi, the past president, Dr. Kalpana Sengupta, the secretary of the club, Dr. Diari Muhammad, chairman of the academic affairs, Dr. Amir Muhammad Tuleymat, Dr. Ayman Jundi, Dr. Rafia Ovara, Dr. Srinivas Bandari, the honorary member, Dr. Leila Bahri, and Dr. Khalid Rashid. Well, as I said, tonight's webinar is about the pediatric nutrition. Our speaker is Dr. Neil Levin from United States of America. In a short while, I will tell you about his profile. We have also with us Dr. Wafa Helmi, consultant clinical dietitian at Al Tawawi General Hospital and Medical Center, Dubai, and Dr. Fiji Anthony, chief clinical dietitian at NMC Specialty Hospital, Dubai. We have with us also moderators very well known to all of you, Dr. Kalpana Sengupta, senior specialist pediatrician and head of the department at NMC Specialty Hospital, Dubai, and Dr. Diari Muhammad, senior consultant pediatric surgeon at Jalila Children's Hospital, Dubai, and chairman of the academic affairs of Dubai Pediatric Club. Well, our 8th annual conference will be on 26th and 27th of November 2022. Well, our organizer, Mr. Tawfiq Ali, he organizes all DPC conferences, webinars since 2015. He's here felicitated by Dr. Ajit Kumar, the chief guest in 3rd annual, and you see Dr. Led Kuhi here, the founder and father of the Dubai Pediatric Club. Well, Mr. Tawfiq has promised to organize future Dubai Pediatric Club conferences in the Sky Hotel, inshallah. Well, Sir William Osler, the father of modern medicine, said, "The good physician treats the disease. The great physician treats the patient who has the disease." Well, I will just briefly, in 7 to 10 minutes, I will tell you about the brief history of child nutrition. And always I start in the memory of Hippocrates, the father of medicine. As I always said, everything starts with Hippocrates and ends with Hippocrates. Hippocrates wrote, "Growing creatures have most innate heat. And it is for this reason that they need most food, deprived of which their body pines away." This is from his aphorism. Well, the father of the pediatric, Al-Razi, who described measles in 10th century. Well, Antoine Lavoisier is considered as father of nutrition. The concept of metabolism, the transfer of food and oxygen into heat and water in the body, creating energy, was discovered in 1770 by Antoine Lavoisier, the father of nutrition and chemistry, just to remember them. Well, the noted 17th century French author, Roger Foucault, wrote, "To eat is a necessity, but to eat intelligently is an art. Well, just briefly about the pioneers in the nutrition. In early 20th century, research in nutrition expanded enormously. In 1912, Casimir Funk described the anti-beriberi factor and suggested that plague, scurvy, and rickets were caused by deficiency of unidentified factors called vitamins that were vital to the life. Now, I would like to tell you something interesting. Casimir Funk thought all these are amines. That is why he called vital amines. But later on, it was found that all of them, they are not amines. They wanted to change the name. They found that it is not fair and embarrassing to change the name. They removed the E. So now vitamins remains from that without E. In 1912, everybody knows McCollum and Steinbach at the University of Wisconsin developed an approach that led to the discovery of nutrients such as vitamin A and D. It is interesting to know that why these vitamins called A and D. I will tell you. And in 1930s, Rose at the University of Illinois had discovered the essential amino acids, the building blocks of protein. Now, I would like to tell you about the term vitamin. As I said, it's derived from the word vitamin, which was derived in 1912 by Polish-American biochemist Casimir Funk, who isolated complex of micronutrients essential to life. That is why he calls it vital amines, vitamins. But it was McCollum who said, no, these are not there, and changed the name to vitamins. McCollum and Davis, American researchers, in 1914 discovered a substance in cod liver oil, which later on was called vitamin A. And McCollum called vitamin D, it was called D because it was the fourth vitamin, A, B, C, D. And Alfred Hess said light equals vitamin D. Why I say vitamin D is so important nowadays in all aspects, all diseases, vitamin D is used. And the importance of vitamin D, I have shown this in one of my webinars, that the logo of American Academy of Pediatrics is showing a child with rickets. In 15th century and 16th century, the ricket was very common. And the idea was to wrap the child, especially legs, and keep in sunlight. So the logo of American Academy. Nowadays, there is deficiency, another vitamin called vitamin F, which is more important. Well, I will tell you about the nutrition in America. Wilbur Owen Atwater, while an administrator at the U.S. Department of Agriculture in the late 19th century, is credited with laying the background for the science of human nutrition. Well, Dr. Atwater wrote the pioneering bulletin that summarized available data regarding food composition, food digestibility, non-nutritional factor, and the ways in which investigations could be conducted to increase knowledge of these areas. He is the pioneer. Well, Dr. Neil must be knowing that they are the pioneers of American nutrition, and it was the article published by DuPont and Beecher in 2017 regarding the history of human nutrition research in the United States Department of Agriculture. Well, now, our question, one of them, Dr. Elsie Widdowson, in 1936, Elsie applied for a grant from the United Kingdom Medical Research Council to travel to the United States so she could learn more about dietetics. In this way, they helped Elsie on her way to becoming one of the greatest women scientists in the 20th century. And the answer for both of them, Icy Macy Hubler and Elsie Widdowson, two pioneer women, member of American Society of Nutritional Sciences, played major role in developing our present understanding of the relationship of food and child growth. So they are pioneers. We should remember them. And here you are seeing Dr. Elsie at Buckingham Palace receiving the award of a championship of honor. Well, just to know, the father of Indian nutrition research, Dr. Gopalan. Dr. Gopalan is widely considered as the father of nutrition research in India. The burning faith syndrome is also known as Gerson Gopalan syndrome, just to remember him. And now our speaker, Dr. Neil Levin. Well, briefly, just headlines. CV is very vast. Just headlines I mentioned. Dr. Neil, board certified clinical nutritionist, diploma in advanced nutritional laboratory assessment, American Nutrition Association co-founder, former director and corporate officer, Nutrition Leaders Council, International and American Association of Clinical Nutritionists, Clinical Nutrition Certification Board, Scientific Council, Mid-American Health Organization, Director, Advocacy Chair, the Non-GMO Project, Technical Advisory Board and Emeritus Member. Our panelists, Dr. Wafa Helmi, Aisha, Consultant Pediatric Dietitian at At-Tawawi General Hospital and Medical Center, Dubai, also at Maui Day Surgical Center, Dubai, and Dr. Fiji Anthony, Chief Dietitian at NMC Specialty Hospital, Dubai. They will be our panelists. Well, I'm ending, always starting and ending with Hippocrates. Hippocrates said, our food should be our medicine and our medicine should be food, and everything in excess is opposed to the nature. Nature is the healer of the disease. With that, I end my references. Beautiful Dubai. Now I would like to request Professor Levin to start his talk. Well, Professor Levin,
yes,
please join us.
thank you, Dr. Sorab. Very nice presentation. I need you to stop sharing screen so I can share mine.
Yes, please.
Okay. Thank you. And I'd like to thank the Dubai Pediatric Club and everyone who joined us today. Dr. Sorab and the moderators and panelists, thank you for taking time for this. And I very appreciate being invited to speak to you today. So I'm going to reference a few specific types of vitamins and nutrients today, multiple vitamins and vitamins C and D, the mineral zinc. I'll talk a little bit about probiotics, also two botanicals, echinacea and elderberry. Now, first of all, from the National Institutes of Health in the United States, they say that people do require vitamins and minerals, including vitamins C, D, and zinc that we're going to talk about today, in order to have proper immune function. Clinical deficiencies increase susceptibility to infections. And there are other ingredients, botanicals and probiotics do not have essential roles in the body, but might affect immune function. So that's all information from the United States government. So we'll start with the multiple vitamins. Why do people need to take multiple vitamins if they are eating a pretty good diet? Well, it turns out that the diet's not quite as good as we've been told. Studies of different foods show declines in protein and vitamins and minerals. It's called the dilution effect. Garden crops are showing declines across the board in many nutrients, including vitamin C. And when we're looking at the trace minerals, we're showing declines of about 70 6% in the United Kingdom, and similar results in the United States over a 50-year period. So micronutrient sufficiency is not being achieved through food solutions in large portions of the population. Although we prefer eating food to get our nutrients, it's simply not enough to do the job for many people. Multivitamins and minerals contribute to a greater number of people meeting recommended intakes of almost all micronutrients measured by NHANES, which is the study of micronutrient intakes in the United States in the Journal of the American College of Nutrition. So here's one of the charts that's describing that. If we look at the children between 9 and 13 years old, 15% of them are deficient in at least one nutrient. When we get to the young boys, young men age 14 to 18, 18% are deficient in at least one essential nutrient. And for young women, 26%, about 1 out of 4 teenage girls are deficient in at least one nutrient. And this is just looking at vitamins A, B6, B12, C, D, E, folate, or if they have anemia. It's not even the entire full spectrum of nutrients. And when we look at whether they're taking a supplement or not, if they have sufficient levels, again, looking at these charts, if they're not taking a dietary supplement, 20% of children between 9 and 13 are deficient, and about 23% of teenage boys and about 37% of teenage girls. If they take a dietary supplement, but not a full spectrum multiple vitamin, the numbers go down quite a bit in terms of deficiencies. But if they take a full spectrum multivitamin, the percent deficiency goes down from 20% for not taking a supplement in age 9 to 13 to 18%, a small decrease to be sure, but the level cuts about in half for teenage boys from 23% to 12%, and from 37% to 13% deficiency in teenage girls. So you could see it's even more important for teenagers to take their multivitamins. And looking at multiple nutrient deficits, where they're not getting sufficient nutrients in multiple nutrients. The area under the curve cuts in about half if they take a multivitamin than if they do not take a multivitamin. The numbers in the middle show people taking certain dietary supplements, but not full spectrum multis. Now, taking a multivitamin is not going to lead to excessive intakes when consumed as directed. They will help meet but not exceed the recommended intakes for the populations. Now, this is a study that was done that shows a relationship between trace elements and viral infections. Iron, zinc, selenium, copper are, some of them serve as antioxidants, especially the zinc, selenium, and copper, and they inhibit viral replication in cells. So these nutrients are shown to be effective in very good research. And this is research from colleagues at United Arab Emirates University at the United Arab Emirates, and also the University of Melbourne, Australia. And they point out that vitamin C, D, E, zinc, selenium, and omega-3 fatty acids have well-established immunomodulatory effects. So it is very important to get sufficient nutrients. When we look at the specific roles of nutrients, here's 3 of them: vitamin E, vitamin D, and vitamin C. And we're talking about vitamin D and vitamin C today. You can see effects on cells that affect innate immunity as well as adaptive immunity, specific actions of these nutrients. And again, when we look at, for example, in the middle here, zinc, protecting cells from oxidants, promote release of cytokines for adaptive immunity, T cells, it has a role as well. And if there's deficiencies of these micronutrients, then there's weakened immune response and vulnerability. Now, when we look at patients with chronic viral infections, we show their levels of vitamins are decreased, and that is associated with higher levels of viral replication and more inflammation and illness severity. Vitamins can suppress or reduce viral replication or viral load in children as well as adults. And what are the roles of these vitamins? They have many roles. We're not going to go through all these today due to time, but if they're inadequate, there's effects on immune system. If they're adequate, we see a modulation of immunity. Certain interleukins go down, certain ones go up, and you modulate immunity to appropriate levels. Same with the dendritic cells, macrophages, T cells. Let's look at vitamin C specifically. According to the Hospital for Special Surgery in New York City, it helps immune system to be healthy. There's evidence that 200 to 500 milligrams a day from food or supplements help tissues reach saturation levels. And again, there's a plethora of scientific literature supporting the role of vitamin C as an immune booster, epigenetic regulation, cell signaling, antiviral agent against coronavirus and other viruses, many roles for vitamin C, including a weak antihistamine. And vitamin C is concentrated in certain immune cells, and it's transported there by the same process that insulin uses to get sugar into cells. So things that help with insulin sensitivity also help vitamin C get into immune cells. Things like alpha lipoic acid, I'll mention. Vitamin C helps with neutrophils and oxidative killing and many different properties. In fact, in leukocytes, you can have 50 to 100 times more vitamin C than in the plasma, and it's rapidly utilized. Diabetics, by the way, have a hard time moving that vitamin C into immune cells, and it's important to try to reestablish proper insulin sensitivity in diabetic patients. And vitamin C has a protective effect in infectious disease. Again, decreased plasma vitamin C concentrations, and they also have increased respiratory issues when they have insufficient vitamin C. Vitamin C has a huge role in fighting viruses and helping immunity, helping with type 1 interferons and upregulating natural killer cells and T cells. And the vitamin C levels can be low also due to metabolic consumption as well as improper transport in the body. And vitamin C supplementation in upper respiratory tract infections is well described in the medical literature, including restoring the damage caused by respiratory bursts and reducing the duration and severity of the common cold in children. When vitamin C is supplemented at doses up to 2 grams a day, there's significantly fewer cases of pneumonia. And for intravenous or oral administration of vitamin C, there are no adverse effects unless there's patients that have certain deficiencies, including kidney and liver issues. Vitamin C also helps to protect the respiratory tracts, helping symptoms of upper respiratory tract infections. And it inactivates both RNA and DNA viruses and reduces pain and inflammation. Reducing levels of pro-inflammatory cytokines and increasing anti-inflammatory cytokines is a good feature of modulating immunity. So helping to control inflammation so it's not out of control. Vitamin D has an important role in immunity. In fact, the European Food Safety Agency points out its role in healthy immunity and balanced inflammatory response, that it allows health claims in those areas. It also helps cell growth, differentiation, and immunity. Vitamin D is unique because you can produce it from sunlight as well, which requires internal synthesis, as well as from certain foods, but it's limited in the types of foods that it's in. Oily fish and some fish oils, especially fish liver oils, will have vitamin D. Fish body oils will not. And wild caught fish will have a lot more vitamin D than farmed fish typically. Lower concentrations of serum vitamin D will be in vegetarians and vegans than in fish and meat eaters. Diet is an important determinant of vitamin D status in the body. And how is it made in the skin? Ultraviolet B rays convert cholesterol to pre-vitamin D3 that converts to vitamin D3 in the liver. There's a kidney role as well. And it's limited to produce vitamin D in the skin if you're at high or low altitudes, away from the equator or at different altitudes. Darker skin pigments delay the vitamin D production in the skin. Winter, sun avoidance, scar tissue, aging skin, clouds, pollution, haze, or it will not pass through glass, those rays. Now, this is an interesting chart from the Vitamin D Council. It shows the ability to make vitamin D from sunlight. And if you look at the inset there, the shadow rule, it shows the sun coming down and making a shadow. When your shadow length is equal to your height, that is the limit of when you can make vitamin D from the sunlight. If your shadow is shorter, you can make vitamin D more easily. The sun is higher in the sky. If the sun is lower in the sky and your shadow is longer, too much of the ultraviolet rays get filtered out and you cannot make vitamin D in the skin. Now, when we look at this chart, the third row down would show, for example, what's happening in the United Arab Emirates and part of the Middle East. You could see you could make vitamin D year round, but the amount of vitamin D you make is clearly better in the summer when the sun is more intense. And in those times, 10 minutes if you're light-skinned, 45 minutes if you're dark-skinned, and that's about 20-25% of the skin exposed to the sun without sunscreen. Now, of course, many people are not able to do that. But the sun rule is, with the shadow, is a good rule of thumb when you go outside, whether you can make vitamin D or not. It's not just the time of day, but it's the angle of the sun and the intensity of the sun. Now, even though there's plenty of sun in the Middle East, one of the world's highest vitamin D deficiencies, 86% of residents were considered deficient or insufficient, is in the United Arab Emirates. And in a more broad study, 30 to 50% of children and adults in the Emirates and Australia, Turkey, India, Lebanon have levels below 20 nanograms per milliliter, 50 nanomoles per liter. And that's about 2/3 of the level that blood tests in the United States are considered adequate. Vitamin D receptors are in the immune system. Supplementation can prevent autoimmune disorders as well. The receptors are on cells like monocytes, macrophages, T cells, B cells, and they actually, there's an enzyme on these cells that convert vitamin D to its active form. So the immune cells have a role in making vitamin D work in the body as well. Vitamin D also helps to differentiate monocytes to macrophages. And it's regulated by vitamin D metabolites. There are feedback mechanisms on these cells. And again, vitamin D has a wide range of roles in the body. This is again from a study from researchers at University of the United Arab Emirates and the University of Melbourne. And they show the roles of vitamin D on different immune functions. We know that vitamin D helps reduce, but not only the incidence, but severity of viral infections. And if your serum vitamin D levels are higher, there's a lower risk of upper respiratory tract infections. Vitamin D also modulates immunity to prevent excessive cytokine activity, but enhancing the oxidative burst potential of macrophages. It actually makes immune cells more powerful, but it prevents the damage from excessive cytokines as a response. And it specifically protects the respiratory tract, including the lungs, from environmental factors. So vitamin D, according to the US National Institutes of Health, appears to lower viral replication rates, suppresses inflammation, increases levels of T regulatory cells, other immune cells, such as B lymphocytes and T lymphocytes, express vitamin D receptors. So vitamin D seems to modulate both innate and adaptive immune response. Without adequate sun exposure, 800 to 1,000 units of vitamin D is recommended for adults and children. This is higher than the current RDAs. For children, the RDA typically ranges around 600 international units. Zinc is another important mineral that we need for immunity. There's a higher risk of infection if you're low. Impaired immune function, hair loss, diarrhea, taste abnormalities. There are some indications that the loss of taste with COVID might be associated with using up the zinc in the body. Delayed wound healing. Vegetarians need more zinc due to dietary factors that impair zinc absorption. Zinc is needed for over 300 enzymes in the body that have effects on the immune system. And it affects many immune cells, oxidative burst, similar to the things we saw in the other nutrients. Getting the recommended daily intake of zinc or getting supplementation is essential, especially in the elderly as well, but children, if they're not eating well, will have an issue with it as well. Deficiency reduces lymphocytes, and zinc supplementation increases immune cells and interferes with viral replication. Zinc seems to reduce the incidence of lower respiratory tract infections in zinc deficient children. Administration within 24 hours of onset of symptoms reduces the duration of the common cold symptoms. Probiotics are an area that's very important. There's a benefit, but the benefits are strain specific, not just genus and species. Reported use of probiotic supplements more than 3 times a week for teenagers and older reduces the level of SARS infections in the US and Sweden as well. Probiotics seem to help with inflammation. It works on cytokines and various immune cells. These are the lactobacillus, the bifidobacteria, and the Saccharomyces genuses. And when you're looking at specific ones of the strains, you see there's an effect of certain strains on whether vaccines work properly or not. That the vaccines will take better, will have better effect if there's good probiotic status. And in fact, in that study, they list studies like Bifidobacterium lactis BL04, Lactobacillus acidophilus LA14, Bifidobacterium lactis BI07, Plantarum species LP115. There's a lot of these that have effects on immune cells. For example, the BL04 can help innate immunity, helps with specific immunity as well. This shows that supplementation with this strain resulted in faster IgG induction than a control group. The vaccine worked better. And we're looking at changes in orally vaccinated humans with better changes, better expressions of cytokines and immunity. And this is another strain, the Bifidobacterium lactis HN019 in an animal study. If they were challenged with salmonella, about 80% of the mice died, and virtually none of the mice died in the control group where they were given the strain. Echinacea is an herb commonly given to children. This is the recommended dosing from the Health Canada monograph of Echinacea purpurea. There's about 7 commercial strains of Echinacea, and the purpurea is the one that has the best evidence of function for immunity. And the dosing, when you're talking about just dried extracts of root powder, this is your suggested dosing. And if you give Echinacea for treatment for initial upper respiratory tract infection, it could actually help prevent subsequent URIs. The risk was 28% lower in children than children that got the placebo. 40% of visits to pediatricians in winter months by children 1 to 5 years old are because of these kind of symptoms. So it reduced antibiotic use, which of course helps with probiotic status in the body. And this is a chart showing the reduction in upper respiratory tract infections. And in children, about 30% of viral respiratory tract infections develop into bacterial pneumonia, sinusitis, or otis media, which creates a need for antibiotics. This study showed support for using 400 milligram 3 times a day of an alcohol extract and significantly reduced the RTIs and antibiotic use. And lastly, I want to talk about elderberry. This is one that's been very popular. Might help prevent upper respiratory tract infections. It inhibits viruses from binding to host cells, and it stimulates the immune system. The antiviral activity is explained by the glycoprotein spikes on the viruses. They can be deactivated by elderberry components, both the antioxidants and other components of elderberry. It's been demonstrated by mass spectrometry and other means, which shows that blocking the function of these viruses to be able to attach to cells and invade cells. Inhibition is stronger against late stage influenza even than early stage. Can reduce the duration severity of influenza in patients. And it affects viral entry as well as viral transmission and modulates the release of cytokines. So that concludes my presentation. I'm happy to turn this back to the moderators and Dr. Sorab. Thank you.
Thank you very much, Dr. Nail, for this excellent presentation. Very simple, and I'm sure all viewers have benefited. Thank you very much. It was really an eye-opener. I myself learned many things. Thank you very much. Now I'd like to request Dr. Wafa Helmi to present briefly regarding picky eater in children. Dr. Wafa, please.
Thank you very much. You can see my screen?
Yes, please.
Yeah, good evening, everybody. Thank you very much, Dr. Sohrab, for the introductory. I thank Dr. Tawfiq for inviting me. Professor Nell, actually, he made my life easy because he just put the floor for me. When we talk about deficiency, he showed that there is a lot of deficiency definitely around. And picky eaters are, according to the studies, overall estimation, we have around 2 billion people suffers from micronutrient deficiency. And that's, again, what Dr. Nell just clarifies some of them and showed the deficiencies everywhere. Estimation around 20 to 60% of the children are picky eaters at some stage of their childhood. And children as young as 19 months may demonstrate picky eating. So it goes along nicely with their new grasp of the word no. They start with, as soon as they start saying no, you can see a lot of pickiness in some of the food. So picky eaters' behaviors includes selectivity, refusals, preferences, certain preferences, consuming very limited amount of varieties of food, unwillingly to try any kind of food. These all we call them as picky eaters. And my key messages from my lecture, which I'm going to finish it as I promised Dr. Sahrab in around 10 minutes, hopefully. The meal time routine is not just a time of eating, but it's a time to build the relationship between the parents, the family in general, and also for the children to be having more socializing skills. These children, the abilities to participate in the mealtime influences their physical as well as sensory environment. So the communication between the parents and the other members will enhance the eating habits of those children. So how to determine if the feeding is adequate? First, we have a question. Is this growth of this nutritional intake appropriate for their age and their medical condition, if any? Well, we have to consider things. First, we have to consider are the liners of weight measurements, interactive optimal growth and age, and the clinical background using appropriate tool for this growth comparison. This is one. Then the medical conditions or the medical factors that requires additional nutrition consideration, like excessive losses or vomits or stool or urine malabsorption, any kind of food allergy. What kind of children fluids level intake compared of what is required for their age and their activities, their urine and stool outputs, all of that should be considered. As well as, are the biochemical parameters within the range? For example, if they have iron deficiency, is the intake of nutrition adequate energy, fluids, proteins, irons, calcium? And you saw the studies with Professor Nell just showed that there's a lot of deficiencies everywhere. Do they take any kind of oral, enteral, or parenteral intake? Do they do any kind of dietary restrictions, prescribed or not? Any differences between parents' perceptions and adequacy of whatever the professional or the pediatricians is saying? The other questions is, are the nutrition requirements being provided in reasonable, sustainable, achievable time frame? Well, also we have to consider the routine, including the sleep pattern of those babies or children, the timing, the spacing, and the duration between the meals, the quantity versus what they eat. We offer them, but do they eat it all? The impact of any kind of medication if there is any kind of disease. Recurrent illnesses, sensory of pain if they are having, if they are on kind of enteral feeding methods, where and how it is demonstrated, the feeding in other settings, like for example, school, or if they are going for a dining. Now, to define picky eaters, there are characteristics. Some of them are to eat 20 to 25 food on a regular basis. They don't eat more than that. They eat very limited or few fruits, vegetables, carbs, or proteins. They can, they should bribe them, they should reward them, or even punish them in order to have the food. Sometimes eat food different than the rest of the family. They, if you have okra, they will not take only, for example, French fries. So it depends on what they have. All these refusals and denials can consider them as a picky eaters. Now, to do that, we have something called the food fortification. And this is one of the strategies to prevent the rapid the malnutrition or the let's say the deficiencies in a kind of micronutrients. It improves the micronutrient status in the population. That's why we have to see what kind of, and we saw the studies, we have a lot, so we have to make sure that they are having their food fortified with the special nutrients or micronutrients to prevent any kind of malnutrition. And in case of food fortification, we reinforce and support the ongoing improvement programs for the multivitamins and minerals, and completing any other kind of approaches for micronutrient status. Now, food fortification is usually defined as the practice to increase the essential micronutrients, including the elements, the minerals and trace elements. And we prevent or minimize any kind, when we do the fortification, any kind of risk or occurrence of micronutrient deficiencies. and we contribute to correct any kind of a specific micronutrient deficiency in the population, such as vitamin D. You have to give the supplementation. You have to make sure that the food which they are having is fortified as well. Now, we have steps to follow. First, we have to establish a proper rules, which is simply we have the parents, their role is to decide what to serve and when to the child. But the child, he is the one who will decide what to have. When you give a food the child too many choices, let them run the super show and show what they want to have. And when they try to force them, just take a bite, or you'll tell them only this bite, or only this will consider as a punishment for them, and they will not have the food. Do offer at least one food for the child which he accepts within the food that you want to introduce. Do offer a choice between the two things that he likes, and let them involve in their meal selection. And this is one of the, let's say, best strategies to do. Do offer them to other appropriate choices, where to sit, and what kind of utensils they use, the best character, for example, in the plate. It will encourage them to eat food more. Step 2, serve proper portions. Means that kids have small stomach. So if you give them a big plate, definitely they will not finish it. Definitely they will consider it as a punishment. Then they can, you always utilize their sizes, use the sizes plate for a smaller portion for them, with their, as well as I said, with their special character. Do limit the thing, like between milk and juice. You try to give them the thing that added calcium, for example, the milk, more than the juices. Try to give them, to help them to learn the cues and the fullness of hunger without screaming and telling them, I told you so, because this is for them is a punishment. 3, we establish a proper routine. We establish breakfast 3 meals and 3 snacks, turn off the TV or any kind of distractions while they're having their food. Do offer them a glass of water between the meals. Do give them snacks between and sweets 10 to 15 minutes for a snack, and 20 to 30 minutes to finish their meal. Because much longer than that, it will not let them eat the food. Sorry. So the picky eaters you shouldn't force them to take a bite. Don't make the food meal emotional, like an anger or bribing or rewarding. Don't be left as easy as possible. Whether the child accepts or doesn't affect your feeling or anybody's feeling. It's his health. He have to take the decision. And don't be dishonest with the children, because children are very smart. When you tell them carrots, it's a carrot. Why they are having the carrot? Because it's, for example, it's good for the eyes. You may need to be upfront for them, added carrot into the muffins, depending on the kid. But if your child notices it, you have to tell them, yes, it is there, even if he doesn't like it and he doesn't want to eat it. See, this is a plan, comprehensive, step by step, week by week. Every week you reset what you want to do, initiate a meal schedule. In the week 3, increase varieties. In week 4, motivate, moving towards for the family meal. In week 5, rotating. In week 6, learning. So you put a plan for minimum 10 weeks if you want this picky eater to reach with you to a status. In conclusion, and fast, the outcomes of a picky eaters and meal challenges can have a significant impact in family. Thus, researchers studies to support healthy dietary intake among young children are greatly needed. Not your job or anybody's job to get your kids to eat and repeat over and over for them. You have to eat. Your job to what, when, and where. But his job is to decide what to eat and when to start eating. By that, I conclude, and these are my references. Thank you very much.
Thank you very much, Dr. Rafa,
I
for
took
this
10 minutes,
excellent
yeah?
presentation. Thank you. I'm sure there will be a lot of questions. Now, I would like to request Dr. Nail, Dr. Wafa, Dr. Fiji, to join us. I would like to request Dr. Kalpana and Dr. Diari to join and start the panel discussion. Over to Dr. Kalpana, please.
Thank you, Dr. Sohrab. Thank you, Dr. Neil and Dr. Fafa, for your very interesting lectures. And yes, the questions have been pouring in. So I would like to start by asking Dr. Neil about vitamins. Like you said that there is a dilutional effect that's happening. Can you please elaborate on this?
Yes, the dilution effect is the term they use for the food supply not containing as many nutrients as it used to. And I actually have a whole presentation on that. We don't have time for it today, but the bottom line is because the varieties of food being grown are different, because the way animals are being fed is different, because the way foods are harvested, ripened, transported, stores is different. It changes the nutritional value. I'll tell you a quick story. One of my teachers, Dr. Michael Colgan from Australia, he was an Olympic trainer. He trained Olympic athletes on how to use nutrition to improve their performance. And he had a compound outside of San Diego in California. And he was juicing oranges as part of the foods he was feeding to these athletes, these elite athletes. And he decided to test that vitamin C. And he tested it, the orange juice for vitamin C, and he found it had almost no vitamin C. And he's like, how can this be? And he looked at the crate of oranges, and it was from a farm maybe an hour drive away from where he was. It was from California. He decided to drive to that farm. He talked to the farmer. He got a crate of fresh oranges. He brought it back to his place and he juiced them and tested the vitamin C, and there was lots of vitamin C in those oranges. It was the ripening and storage, basically the storage, that had made it lose all the vitamin C that was in the oranges. So just something as simple as that, the same trees producing the same oranges. So it was a good experiment, but there was different amounts of vitamin C depending on how long it had been stored and how it had been stored. So also, the varieties of food grown, the fertilizers used are different as well. When the United States Department of Agriculture food tables that are used to determine food labeling, for example, when they were created, it was before World War II, and all agriculture was organic. They did not have petrochemical fertilizers and these synthetic fertilizers at that time. So the soil was better nourished. When they changed the soil fertilization to the NPK, the 3 minerals, when they changed the varieties of foods grown so they would look good, ripen at the same time, but not have as much nutrition. I mean, you've probably noticed if you buy something fresh from maybe a farmer's market, it's different from getting stuff in a grocery store that's been, distributed and processed, and there's so many varieties. When I go to a grocery store, I might see 3 or 4 varieties of apples. If I go to the Pacific Northwest, I've been to farmers markets in Portland, Oregon, and Olympia, Washington. They've got 150 varieties of apples. Those are not being offered to everybody, just locally. So there are differences in the nutritional values that have not been keeping up with what's supposed to be on the labels. So when we're looking at all these studies saying how much nutrition people are getting, they're basing that on the labels and on the food tables, which are no longer accurate. The food supply has been diluted by changes in agriculture and food handling.
Very interesting.
Yeah.
And not such a good news for people in UAE, where a lot of our food is actually imported. So I think the stress on, growing local things and eating local stuff is well understood from this experiment.
Yes, I actually take a multivitamin myself, even though I take a handful of pills of supplements for various reasons. I always start with a multivitamin, even for myself. And that's where I'm getting my zinc. That's, in addition to my diet, that's where I'm getting my vitamin A. I'm taking extra vitamin C and extra vitamin D and other things. But the base of it, the foundation is the multivitamin.
Right. Yeah, Dr.
Yeah,
Diyari.
so Dr. Neil, thank you very much for this nice presentation. So now we can take it on the other way. Now the fruits and vegetables became harmful. So can we, because in one study from UK, 70% of the nutrients has been reduced. So whatever you are saying as new delusional, or it has been replaced by any other nutrients?
Well, no, what's happening is they're not nourishing the plants enough. There's 72 trace elements typically in the soil. And if you're replacing 3 of them and you're using the same farmland for 100 years, 150 years, 200 years, that soil gets depleted of these other elements. And the plants are not healthy enough to make the nutrients that we need in the plants.
So exactly for that, in agriculture, they are changing every year. The fruits they are changing to another type.
Yeah, in fact, it's been shown that stress on plants improves their nutrition.
Yeah.
For example, if an insect eats on them, it makes a toxin. That toxin to the insect might be a nutrient to us.
Good.
The polyphenols and those other types of nutrients, the antioxidant value is largely dependent on stresses in the plants. And when we give them plenty of nitrogen and when we give them plenty of sunlight and water and they don't have environmental stresses like they do naturally, that also reduces their nutritional content.
Exactly.
So would you also agree that there is a difference in the bioavailability of natural versus the preparations of multivitamins that one takes, or is it just the same? How our body would handle those?
Yeah, one important factor is you have to extract the nutrients from the food to be able to utilize those nutrients. So that starts with good stomach acid. If you don't have good stomach acid, you're not going to get your zinc from your food. You're not going to get your vitamins out, your vitamin B12 and things like that out of your food. They'll remain in the food matrix. So you have to liberate them from the food matrix with digestion. And it starts with stomach acid and the pepsin in the stomach, the pancreatic enzymes, the bile, all those things that you need to digest. The probiotics have a role in digestion as well, which many people are not that aware of. So if you can't digest your food, you're not going to get those nutrients to be available. The forms that are sold in supplements are liberated and bioavailable. Now, what's interesting is that the forms in the foods are typically not the active forms in the body. And the same goes with the forms in the supplements. In many cases, when you're looking, say, at the B complex vitamins, the forms in the foods and the forms in the supplements are different, but they're both precursors of the active forms in the body. And the body doesn't really care too much which one it gets because it can make it out of either one. It's like certain cars can run off of ethanol or petroleum, gasoline. It doesn't matter to that car which fuel you give it. In the same way, our body can make the active components from different sources. And having it be stable and liberated from a food matrix often makes it more bioavailable. For example, food folate is only about 60% as bioavailable as folic acid in supplements, according to the National Institutes of Health in the US.
Right. So what would be your advice to parents in terms of diet of children? I mean, it's probably not fair to say that each and everyone should take multivitamins. And, I know it is against the classical teaching. So
it is against the classical teaching, but in surveys of dietitians in the United States, about 97% of them either use or have used dietary supplements. So although they would recognize more than anyone else the value of food and getting your nutrients from food, they also recognize that there are limitations. As was mentioned earlier, by Dr. Wafa, the people who are not eating well are not getting all the nutrients they need if they're not eating a good balanced diet. People on plant-based diets, it's harder to get your protein, it's harder to get your omega-3, it's harder to get your B12, it's harder to get your copper, it's harder to get your iron. There's so many things, every restricted diet you look at has limitations like that. Someone on a Paleolithic diet are missing certain nutrients, including fiber. Some of these things that are very important. People on gluten-free diets also often have a lot of potential deficiencies. They're missing maybe sources of vitamin E, other things, and the fiber again, other nutrients. So every time there's a limitation, whether it's voluntary or cultural or religious, there's some kind of thing that is missing. And that's why traditional diets that have built up over many centuries tend to be very good, because they have learned how to compensate for those differences. And someone who just adopts that diet without fully embracing it and following all the tenets of that particular diet, the diet that's been well established, they're missing things in many cases. So I think multivitamins, since they don't tend to cause excess, it's kind of like having insurance. If you have insurance on your car or your house or something, you're protecting against something going wrong. What happens if something goes wrong in your nutritional protocols that you're using? What is your insurance? The multivitamin is your insurance.
So as just Dr. Harkin mentioned, if in a clinic, usually nowadays, parents requesting for giving multivitamins to their kids. So you advise us to prescribe, or there should be some values, or to test for some values and then to prescribe?
Yeah, if it's a low, moderate dose multivitamin, there's probably little or no risk to them taking it. And the upside is if they're not eating well, or if their food is not containing what it's supposed to, or if they have increased needs for certain nutrients, which certain people do. Then, we have things like the folate, MTHFR, enzyme variations, the mutations, where some people might need 5 times as much of the folates than others because of their genetic issues. There are reasons why people might benefit from a multivitamin, and the upside is much greater than the risk. The risk is very low, as those charts I showed on my slide show.
So in some clinical situations, like in the hospitals, patient having, for example, burn, and which we know that they are in a catabolic phase. So would you recommend to increase the doses of nutrients, or as a standard just to give?
Yeah, there are sometimes reasons to increase the levels of nutrients. We know when someone has an active infection, their level of zinc goes down, their level of vitamin C goes down, and is below the adequate optimal levels if you're looking at a healthy person. So when you know the body's using more of certain nutrients, why would you not ensure that they're getting those nutrients? You can do testing if you want, but getting a multivitamin is a pretty safe way of ensuring that they do. And especially for lower income ones where they don't want to pay for testing, that's another issue.
I would request Dr. Wafa and Dr. Fiji to also join.
I would like to comment on the burn cases. Dr. Abdurrahman, you have asked about the nutrition for the burn cases. Usually, yes, certain nutrients should be, of course, high protein will be there, high calories because of the catholic status. But I would like to add to what Professor Nell said. We go for HMBs, certain kind of nutrients that enhance the tissue regeneration. Some vitamin C increasing, plus the proteins, of course. but we will look if he's not in septic cases, so we can add a little bit of arginine and glutamine if he is not on a septic cases. So it's individualized, but we add certain kind of nutrients that enhance the recovery in burn cases where the catabolic status is very high.
Actually, I looked at burn cases specifically for children, and children suffering from major burns, according to this is a study in the Journal of Emergency Critical Care Medicine in 2018. They should receive vitamin supplementation in the form of a multivitamin, in addition to vitamin C, vitamin A, and zinc to ensure adequate wound healing. Protein in burn children is higher than the RDA and should be between 1.5 and 3 grams per kilogram.
That's true.
Carbohydrate should be 55 to 60% of calorie intake, and the lipids should be less than 35%.
Yeah, exactly.
So, yeah, I mean, I think there's a general agreement that there's specific needs there.
Yeah, for them, yes.
Yeah.
According to the weight and height, yes.
Yeah.
But it do a marvelous job. I saw so many cases that they were really bad, really bad. And with the patients and good nutrition, medical nutrition therapy, they can be saved.
Yeah. Well, it's clear that in cases where the demand is more, we need to supply that. And obviously in severely ill patients, critically ill patients,
yes.
cases of burns, definitely it is needed.
Yes.
I still struggle with the idea of prescribing multivitamins to healthy children or children attending our OPDs for the sole reason that in clinical practice, it's often seen that it is taken as something by parents to latch onto. They are giving multivitamins. They don't put in the effort to put the habits in place. So that is what I feel that we should also insist upon, because it's taken as, okay, they're popping in multivitamins, it's taken care of. So
Can I add something? Can I add something? Can I say that, for example, as Professor Nell said, vitamin C within like few minutes, it will, even if you squeeze it and just keep it till they come to the, struggling for the babies or the children to come to the table to eat, it will be evaporated. So you have to take the vitamin C mostly as supplementation. Vitamin D as well. You have to take vitamin D with a good fatty meal that it should be absorbed in a proper way. As I was in one of the studies which have been done in the UAE for vitamin D deficiency, which we have quite a lot. Even you won't believe, Dr. Kaban, with even when you prescribe them the vitamins, the compliance is very low. No people follows the prescription which you have said, neither by good food nor by having the supplementation. So at least we should encourage them to make sure that they have the healthy, balanced food in the right way, that they can be the vitamins should be benefit and absorbed, plus having the vitamins which is needed upon lab tests. See, you don't just prescribe. I never prescribe like that. I have to make sure that I did the full blood count, full blood test to check all the zinc, the magnesium, the vitamins. Then I prescribe accordingly. So we don't just, and you know that for vitamin D, for example, and Professor Nell, you can correct me, vitamin D, even if you have the normal, you have to have the maintenance dose, the minimal recommended daily allowance, which I don't think people get it from food. So you have to have it as a supplement. So certain things, you should take them as a supplementation.
Yeah, the vitamin D is a good example because, the amount you get in a multivitamin is fine, but that's enough for bone and dental health. That might be enough for immune health, for muscle health. We're talking about pediatrics here, but when you're talking about elderly patients, the European Food Safety Agency actually recognizes a role in vitamin D preventing swaying, loss of balance, and falls in senior citizens.
Yes,
So there are many roles of vitamin D, including immunity, beyond the RDA, which is built solely on bone and dental health, which is a lower level than what's needed for some of these other benefits. And the amount in a multivitamin is not going to be anywhere near the upper levels that are recommended as the higher level. For example, the upper limit on vitamin D for children, if there's it's 1,500 units, 38 micrograms for age 7 to 12 years old. It's 2,500 units, 63 micrograms for older ones. You're not getting anywhere near that typically in a multivitamin, and those levels are about 2.5 times lower than the actual limits in medical studies.
Yeah.
So like when they say the upper limit is 2,000, that's based on studies saying that it should be below 5,000. So they add this huge margin of safety even on the upper limits.
Yeah.
So you're not expected that there will be any negative effects from going below the upper limits, and even in some cases above the upper limits on these supplements. And there's people who need excess zinc, for example, or excess other nutrients where they're just not absorbing it, or they have poor metabolism issues. There's a test we use, the urine organic acid test, which shows metabolites, and it'll show things like homocysteine, but it shows dozens of those where there's some nutritional intervention possible. It shows if the lipid metabolism is out of balance. It shows if probiotics are overgrowing. There's many biochemical metabolites that should not be accumulating in the body. And if you have them, it indicates something's wrong in a certain chemical pathway. So, that we have many tools besides just testing for the nutrients themselves to see how someone's metabolism is, if they have unique challenges. Nowadays, we have genomic research, and for example, the folate issue can be detected, and we could see if people need more folate, more B12, more B6, those kind of things, which can address them. So there are nutritional ways to do that, as Dr. Wafaa points out. But there's also ways to look at the metabolism that are, the urine test is non-invasive.
So one of the questions are, what are recommendations for healthy full-term baby with vitamin D and multivitamins supplementation? So what's the recommendation for a healthy new?
Well, we normally don't give multivitamins to infants, but we do give vitamin D supplements, the drops, to infants. And the recommendation is 400 units of vitamin D, which is 10 micrograms, be administered to infants. And there's actually a program in the United States where my company and Abbott Labs combine, and we give products to new mothers when they're leaving hospitals. And in that packet they get is a bottle of liquid vitamin D drops with 100 units per drop. And it's recommended to give 4 drops a day to the infant. So, but we're not giving them multivitamins. They're supposed to be getting their nutrition from mother's milk or formula at that point, and it's very controlled. So they're not, you don't really have picky eaters at that point where you have to worry about that. But you do have to worry about their vitamin D status, especially if the mother doesn't have adequate vitamin D to be in the mother's milk.
And another question, when we are prescribing multivitamins, we are going to check for toxicity?
I didn't hear about toxicity. I don't know about Professor Nil.
Yeah. People are not typically getting toxic levels from those. One of my slides, a couple of my slides showed that people are not getting excess in the nutrients when they're taking multivitamins. It corrects their deficiencies without throwing them above the upper limits. It's very rare anyone would go above the upper limit, and it's within that safety margin built into the upper limits.
But when there is, for example, chronic diseases, liver or renal problems, then we have to titrate the dose?
Yeah, you might have a problem there if they can't metabolize these properly. Yes, that's a good point.
Well, I think it is safe to say that the recommended doses of vitamin, especially even vitamin D, would not cause a harm. But I don't think we should give much above the recommended dose, because we have clinically seen difficulties. We have seen cases of nephrocalcinosis and things which can happen. Of course, if somebody is deficient, there are clear-cut guidelines and we follow those levels. Moving on, I would like to open the discussion on vitamin C and viral infections, especially COVID, Dr. Neil, because this is a very controversial area. A lot of studies have been done in the last couple of years on this. So I would like to know your opinion on this. And I would like Dr. Fiji and Dr. Fafa also to join in.
Yeah, vitamin C is essential for immunity. It's needed to protect tissues as well. It is needed to make and maintain collagen. So blood vessel walls, lung tissue, those areas really need vitamin C to be maintained. And as one of my slides showed, the level of vitamin C going into certain immune cells is 50 to 100 times as the concentration as what's circulating in the bloodstream. And it's important that vitamin C gets into cells. The half-life of vitamin C in the serum is only about 30 minutes. And the reason why we don't all have scurvy is because we have ways of recycling oxidized vitamin C using other antioxidants, because of the variety of our diets allow us to survive without making our own vitamin C, as most mammals do. So we need this vitamin C, and if it's being used up in the immune cells, we don't have enough to maintain our arteries, our collagen all over the body, our joints. You know, obviously that's going to be a bigger issue for people who are older or who have degenerative diseases. But you certainly need to make sure that they get enough vitamin C. And as I mentioned, diabetics actually have the worst vitamin C status in their immune cells. And because of their poor insulin sensitivity. And that's one of the pathways of vitamin C to move into immune cells, muscle cells, bone cells, fat cells. So having adequate vitamin C is important. And it doesn't, as was mentioned earlier, it doesn't last that long. If it's not moving in the tissues, it's going to degrade rapidly, and you're not going to have it available for the cells and tissues. So that's even more important to maintain that. If I had COVID and I was hospitalized, I would certainly find a vitamin C intravenous infusion very welcome. And I think it would probably help. And the side effects of high vitamin C orally are GI disturbances. You end up with a loose stool. And some people actually take enough to get that to figure out how much vitamin C they can absorb and go below that amount. It's a vitamin C calibration test orally. You don't even have that problem taking it by infusion. There's no GI disturbance because it's not going through that system.
Okay, can I add in a practice?
Yeah.
In COVID, we had already demonstrated a very high dose for the first 3 days in the pandemic time, 6,000 milligram for the first 3 days, and then we continue to give 2,000 milligram, then up to 1,000 per day for a month. And that showed a lot of differences and a lot of effect on the patient's response with, of course, vitamin D, zinc, along with the recommendations that have been given to the patients. And it showed, yes, a tremendous effect. I'm talking about adults. Of course, for pediatrics, we give, of course, less amount according to the physicians or the pediatrician's recommendations, but it had definitely an impact with COVID, recovery, fast recovery, and prevention of deterioration or lung effect.
I would like to request Dr.
Well, yes. I was about to start about the COVID only. Dr. Kalpana, as you have mentioned the importance of nutrients and how the COVID time, the patients were struggling, I would like to bring the point about the gut function, because whatever we talk, whether you give supplement, whether you give natural source, there should be a proper gut function. And for that, we have to first see whether the bowel movement is regular or not. And we have seen both in inpatient as well as in the outpatient, most of the pediatric patients have the problem of this gastritis as well as constipation. And the constipation is also a problem with the routine. The routine in such a way that, they don't want to go to toilet before they go to the school, or they don't want to go to the toilet in the school, or they don't like the school toilet, so they will hold the urine as well as the stool. So the constipation is a big problem with respect to the nutrient absorption. Now, if you don't have a proper bowel movement with respect to that, the gut function is affected, then any nutrients will not get absorbed. Of course, the supplements will have a more bioavailability chances, but anyway, the supplements alone will not be able to thrive the human being. The children needs the more nutrients from the natural products as well. So the children needs to be on a balanced nutrition. There is no doubt about it. Yes, if they are deficient, which is proven by the lab results, they can be supplemented. That is what is my say. And that's what I will recommend for any patient, whether it is inpatient or outpatient.
That's a great point, that the gut health has to be there. That's one of the reasons we talked about probiotics a little bit here, but that's just touching on that topic. One thing I'd like to mention as a caution, sometimes supplements are available in the gummy forms and for children.
Chewable.
Yeah, but the gummies, even they look and taste like candy. Most of them are made by candy makers. They tend to be low strength in the nutrients compared to capsules or even chewable tablets. And if children get into them, vitamin C, they might get a loose stool, which might actually be good for some kids. But if you're getting vitamin D or something else, zinc, you don't want them to get too much of that. And having access to those bottles. So always keep those supplements away from kids. Don't tell them it's candy. You need to use some caution when you're giving things that might be attractive to them if they can get a hold of it and think it's going to be something that's fun to eat that might actually be harmful.
Yes.
Yeah, actually we have seen
regarding probiotics. Now we know that the microbiota of the intestine for each person and each region is a signature. Now it's accepted to use the same probiotics which is used in Japan or in UK or in USA, in UAE?
Well, actually, a lot of these strains have been studied. They've gone through test tube studies on cells. They've gone through animal studies, and they've had human clinical studies. And the human clinical studies are typically done on diverse populations. So that kind of eliminates the idea that a certain strain will not have a certain effect if they've done a clinical study on different populations, different ethnic groups, and seen how they work.
Because there were a lot of studies regarding Japan, for example, and USA, and those who immigrant from Japan to USA, their microbiota has been changed to the USA style. So you might use the...
Yeah, but the one in Japan's more diverse. That's one of the problems. If you have fewer than 50 to 100 strains of probiotics in your GI tract, you are not going to be healthy, even if they're the best strains in the world. You don't have enough diversity of the population in the gut. So you need that diversity, and adding proven strains from different countries is beneficial. One of the strains I showed, the HN019 strain, is from New Zealand, for example. It's not from the US, Canada, somewhere else. These strains are actually isolated, but they're in the soil, they're in the water, they're in the food supply to some extent. And if you get these healthy ones, you're seeing in studies of, again, diverse populations that there are benefits. So I think the point is a good point, that, asking about that, and the diversity still is an issue. If someone's taking a bottle that has 1 strain, 5 strains, 10 strains, That's simply not enough. No company has all the strains you need for your body. Eating raw fermented foods, eating fiber is actually more important than taking supplements. Your bifidobacteria and your anaerobic bacteria in the large intestine are more dependent on their food supply from soluble fiber than they are from supplements. Taking supplements might not establish colonies of probiotics if they don't have a good food supply. You could be taking those pills all day long and they won't do anything. So the environment is still important. You need the variety, and the fiber is going to provide that, as well as what they're getting from the environment, their food, their water, their supplements, all combined. It's not just supplements.
Moving on to zinc, that is one nutrient that they say that our body does not store, and hence it has to be provided either through diet or through a supplement. So which are the conditions where the requirement increases, I would like to know, and also what are the normal sources of zinc in our diet?
Well, zinc can be from whole grains and things like that. There's a lot in certain seafood. Seafood is probably the highest amount of zinc. But zinc tends to be much lower in things like grains or other foods. You get tiny bits of zinc from different things. Pumpkin seeds are considered a good source, for example. But again, vegetarians, because there's anti-nutrients in the plant foods, they tend to, and the forms of the minerals tend to be bound up in some of the plant foods. The same way heme iron and non-heme iron, where in red meat, the iron's very bioavailable. In plant sources like spinach or things like that, it's not bioavailable as well. The same thing happens with zinc and copper and the other minerals in foods. Remember, you need good stomach acid to remove it from the food. You have to solubilize it turn it into a chloride, basically form, in order to absorb it well. So you need good stomach acid is the other thing. So when you're getting the supplemental forms, they're typically pre-acidified. They don't require digestion. So there's an advantage to taking supplements over foods in terms of bioavailability and how certain that bioavailability is. And certainly in terms of dosing as well, there's a more certainty. But that doesn't mean you shouldn't be eating these healthy foods. As has been, we've heard over and over again, food should be the base, and the supplements are your insurance or your therapeutic interventions.
To add to that, Dr. Kalpana, oysters are the richest source among the seafood, the zinc source, and even cocoa powder is rich in zinc. So even we can add cocoa powder to the children's milk to add zinc in their diet. Among the seeds, the sunflower is the richest source. And those who eat meat, beef is the richest source.
Thank you, Dr. Fiji. Would like to ask Dr. Wafa about picky eaters. How does a child become a picky eater? What leads to this condition?
Actually, picky eaters become like as I said, it is something a habit happens with life. The parents. That's why I said they have to recognize, they have to look, they have to observe. It comes, like, for example, when the father is simply by the age of 1 year, they start sitting on the it's adaptation, first of all. So they are in the same table, and he said, I don't like okra, for example. It remains in the childhood. By time, he hates okra without even tasting okra. So the first thing that we have to be a role model. The child, he imitates, he likes to see what their parents doing, and he does the same. So it starts from very, very young age. First. Second, we have to try, as I said, we have to give the time for a trial for the baby, for the child, from the time he starts being, with having the family food, to start tasting and deciding how much to have and what to have. all, not to bribe, not to reward. All this can lead the child to become a picky eater. So we have to really observe all the notes that happens between surround us, and observe the child and offer him what he needs in the proper way to prevent having him. And as I said, every time we try a single type of food, like when you test for allergy, it is the same way. Introduce it slowly. It takes 10 to 20 times for the child to adapt for any kind of food. So within the trial, so you have to be patient to try, engage the child, let him try to cook with you, to buy the food with you, in order to prevent of having him as a picky eater.
Yeah, this is one category where the parents get most disturbed, exasperated. They have tried everything. No matter what advice we give them, they say, we've done this, we've been through it. It's really, really difficult to get these children. I recently had a 3-year-old who was an inpatient for some reason. And during the stay in the ward, I realized all he takes is milk and breadsticks. That's it. Breadsticks and milk, and those small breadsticks. So it was like so disturbing for us, because we had to break this habit. And it was to do with the parental education and, you know,
you have
continuously
to be
monitoring. Yeah. So
you have to be patient. You have to fortify the food that he's having, even that milk. It should be fortified at least to make sure that he's having enough nutrients and calories. Plus, you have to play it, as you said, you have to play it in a very smart and patience, to be very patient in dealing with them. And you will succeed at the end.
Excuse me, may I interrupt and ask one question? Supporting Dr. Nail's statement, they have done studies in different Middle East countries, up to 80% deficiency of vitamin D, 30 to 50% deficiency of zinc. And in fact, the first cases of zinc deficiency with the endocrine problems, all reported from Middle East. So giving these multivitamins, they're already deficient. These studies they are showing. So if we are giving, we are not causing harm. In fact, we are doing good. And in fact, in England, Ministry of Health, according to one of the professors, up to 2 years, irrespective of the clinical condition of the child, normal children, up to 2 years, they recommend multivitamin and iron.
Yes.
So this is we are keeping in mind these studies. I think giving vitamins not only has adverse effect, it will help. And a study shows that up to, this 80%, 50% deficiencies. I agree with
That's
Dr.
why we
Nail.
recommend the vitamin supplementation. True. We insist on following them thoroughly, closely, and monitor them. Monitoring, it's very important. Screening is very important, because we didn't know till we did the study. And after the study, we discovered that everybody is having vitamin D deficiency. Then we start intervention, but we don't stop on that. After that, you have to do another screening and another monitoring to make sure that you have done the right intervention for those.
I think one of the studies. Sorry, I'm interrupting. It is generally taken that the 30 is normal, 20 to 30 mild, less than 10 is 50 international unit. Actually, in one of the meetings, I think Dr. Nail also mentioned, if it is 50 and low, then we should, treat them. We should not consider 30 as a, limit for the normal. What is your opinion, Dr. Nail?
Yeah.
I agree.
Well, there's two scales for vitamin D, the nanomoles per liter and the nanogram per milliliter. And on the nanogram per milliliter scale, 30 in the United States is considered adequate if you're getting a blood test. That's what the labs will show as being sufficient. If you're looking internationally, the standard tends to be around 20 nanograms per milliliter. If you multiply that by 2.5 to get the nanomoles per liter. So that would be the 50 nanomole per liter, which would be considered adequate, but not optimal. When we're looking at the benefits beyond bone and dental health, we're looking at between 30 and 50 nanogram per milliliter being optimal, which would be a higher level. And at about 88 nanograms per milliliter, the body stops making vitamin D and downregulates the vitamin D metabolites. People do not get vitamin D overdose from the sun because if they can tan, because the tanning blocks it and stops that process. So the body, it seems to be somewhere around 88 nanogram per milliliter is the level the body starts tapering off and not allowing the vitamin D to be produced anymore. And its levels over 100, probably closer to 200 nanogram per milliliter, where you're starting to get the kidney damage and things like that, where you're seeing some overt problems from overdose. And you're not anywhere near that if you're at 30, 50. You know, I've had levels where they're in the 50s, and I actually think that's good, because then my chances of dying from cardiovascular disease go down by about 2.5 times versus people whose levels are below 15. My levels of immunity and my immune cell strength is much higher at those levels, and I'm not at any toxic level. So obviously you're not going to probably try to get children up to that high, but you know, if you're at 20 to 30 nanogram per milliliter, that would probably be the bottom line you want for just healthy, optimal, everyday levels.
So Dr. Nell, there is one question. Does sunscreen prevent from making vitamin D?
Does what prevent it?
Sunscreen?
Yes. Sunscreen, covering yourself, low angle of the sun, you know, many things can prevent that, but sunscreen is specifically designed to block those solar rays. So people who use sunscreen, it's just like covering yourself with a hat and everything covered.
And another question, is it safe to take multivitamins over the counter without prescription?
It is safe, but you certainly want to use reputable brands, because vitamin D is a little difficult to test. And if you don't use like a mass spectrometer with your high performance liquid chromatography, you're not going to get very precise results. You're going to get very broad ranges. So a lot of companies are getting these broad ranges. We're seeing that even worse in the gummy type products because it's hard to control. And these are not dietary supplement companies used to stricter manufacturing and testing standards. These are candy companies typically making it, and their good manufacturing practices are not as strict. And I know in some studies they have shown that testing these gummy forms that are given to children, they're finding wide variations from the label claims. So you really want to stick with established companies that have good testing to make sure that they're doing their job right. And so many over-the-counter companies are not good, some are. You know, the larger, more reputable companies are typically a better bet than a small company nobody's ever heard of, and you don't know what kind of testing they're doing.
There's a question about organic foods, since we spoke about declining nutritional values. Do the organic foods fare better in that respect? Because it's a big fad world over.
Yes, I actually have a whole study on that too. Nutrient differences of organic, genetically modified, and conventional foods. And there are differences. The differences are typically in the plant foods when you're talking about organics, but there's also some differences in the animal foods. The animal foods, if they're organic, will have more omega-3, more conjugated linoleic acid, things like that, that will be beneficial. And GLA, is another one where they're going to be higher. I know in England several years ago, the organic milk producers were asking to put a claim on their packages that say that they're a good source of omega-3 and these other healthy fats. And the government turned them down because it said normal conventional milk was not a good source. And so the definition of milk did not include these nutrients. So they actually turned down making a claim that you get additional nutrients in organic milk, and it would be the same with organic meat. And grazing animals would be similar to organic meats in terms of incorporating these fats into their meats as well as their milk. Now, because organics, they have to graze, at least most of the year. Now, that doesn't mean all milk products that are organic are going to be better. Organic whey protein, for example, because it doesn't contain the fats, is not going to be nutritionally different from non-organic whey protein. So it depends, it really is more focused on the fats and the fat-soluble nutrients than the other nutrients in the meats and the milk. Now for plants, it's a little different because the organics, they tend to feed the soil more and they have more mineral nutrition. The elements are there for the plants to make their nutrients, which we need. And you're seeing higher ranges of antioxidants, polyphenols, vitamins, minerals in organic versus conventional plants. And these are based on studies where they have adjoining plots. So the soil's the same, the sunlight's the same, the rain's the same, the weather's the same. The only difference is the soil and the plant treated with organic means or conventional, chemical fertilizers and pesticides and things like that. And they routinely find higher levels of nutrients in the organic foods. And predominantly they're antioxidants and polyphenols, vitamin E, vitamin C, but it's also B vitamins and vitamin A and minerals as well.
Dr. Neil, my question, I would like to ask about hydroponic. What do you say for that? Hydroponic green leafy vegetables, very common. The kale, collads are buying in the market. So they say that it's very nutritionally competent when it is compared to even organic. What do you say about that?
Well, I don't think they will match the organics. Most hydroponics use chemicals. It is possible to have an organic hydroponic, but it's rare. So they're using chemicals. The other thing is when you realize, as I mentioned earlier, that the plants are sensing stress and making certain compounds that we consider nutrients based on the stress levels they face. Hydroponics do not have stress in terms of sunlight, nutrient loss, bugs on them, weather extremes. So they are not inclined to make as much nutrition because they're not faced with the challenges that provoke them to make the nutrients.
But at the same time, they say they don't have the dilution effect. They say that they do have all the nutrients in the superior quality.
Only if they put those nutrients in the feed.
Yes. That's what they have.
Right. And the feeds are normally chemicals. I mean, if you could do an organic one, it would probably be okay. But, you're relying on, a lot of the nutrients in the plants, the B vitamins, the things like that, not the minerals. The minerals they could take up from the liquid as well as the soil. That's not a problem. The problem is the polyphenols, the vitamin C, those kind of things they're making in because they're provoked with challenges.
Okay.
They're going to make more vitamin C if they're in the wind because the wind is going to require more structural material. And, just like we use vitamin C to make collagen, structural material in the body or bones, they need vitamin C to make their structural material. So they're making it based on an environmental challenge that the wind is moving them and they need to be stronger. If they're sitting in a greenhouse and there's no wind, there's no challenges, they don't have any reason to make these compounds. They could pull minerals from the liquid, but there's typically not vitamins in the liquid or polyphenols or things like that, bioflavonoids. Those are being made by the plant in response to environmental stresses.
Okay, thank you.
Yeah.
May I ask Dr. Wafa still with us?
Please, you may, of course.
Yeah, Dr. Wafa, as you know very well that some deficiencies causing, as I am a pediatric surgeon, causing congenital abnormalities like spina bifida or folate deficiency. So is there any work going on to fortify the foods with folic acid?
Well, it is recommended, actually, even now.
It is recommended, but
mostly-
it is done in UAE. We have any?
Now the formulas, they are fortified, definitely. Certain kind of food, whether it is fortified, I'm not aware of that. I don't know whether Fiji knows, but I have to know that. But because when we talk about food for them, we recommend a balanced diet for the mother while she's pregnant. And we make sure that she have supplementation from folic acid as a tablet.
As tablets,
Because
no, the
it's
flour
good,
and
we
these
take it
things
in generally,
fortified.
but it's not enough. It's not enough. So she have to take it as a supplementation. But for pediatrics, I mean for children, they will take the formulas if they are having mother's milk. That will be enough.
I am
Because
asking
she's
about the
taking
mothers.
fortification. She's taking the tablets. If they will have from the milk enough folic acid for the babies. But if not, then all of them are fortified anyways. But not the food. No.
Not the food.
No.
Dr. Dairy is Dr.
really
Dairy mentioned,
question.
like a salt, iodine fortified salt in the market. There is something coming up as a folate rich products in the market. As such, I don't know. I don't know.
No,
But it's time. It's time.
Isn't. I didn't see it yet.
No,
But it's
flour
time.
fortified with folic, because so many mothers or childbearing women, they are having deficiency in folic acid, which gives birth of neural
Well, we have
defects
to
like
ask
spina
somebody
bifida.
who knows about food production. That's not my area. I'm a medical. So I don't know whether somebody have, because it have to be stable, the bioavailability of it, that's not my area. So I wouldn't be the person to answer.
And even Madam Wafa, even if it is fortified flour with the folate, after cooking, making into a chapati or kubus, what will be the availability?
That's what I'm saying. That we need somebody who's expert in that area, which is not me. I'm really
so
sorry.
if it's something like a breakfast cereal, yes, we can just say that. We can just mix it with milk, so there is a less chance of getting depleted in any form.
Yes.
Dr.
That's
Diari,
possible.
mothers usually given supplement of, for vitamin and folate during pregnancy in order to prevent that.
That's sorry, Dr. Zoraf, that's not correct, because we have a lot of mothers which giving birth to a child with spina bifida, and they deny that anyone mentioned to them to take folic acid.
Weird, because it's a policy.
Even if they are high risk. Even if they are high risk, that means they have a previous child with the spina bifida.
That's something weird, because it's a policy. It have to be given.
In fact, Dr. Diari, if they are told when they are all pregnant to take this, sometimes it is already too late.
Yeah, too late. Yes, they have to be.
Late.
No, not during pregnancy.
They have to be
even before they are planning to get pregnant.
It should be 3 months before planning to get pregnant, minimum.
So it is the responsibility of probably every physician who sees anybody in that age group to mention it to them or to prescribe to them. I would like to ask you, there are certain questions about the diets that people follow these days, and a lot of adolescents are interested nowadays in vegan diet. So Dr. Wafa and Dr.
Vegan diet, if he is a vegetarian by tradition or by religion, I respect that, because this is the religion. And we advise them to take supplementation for iron, vitamin B12, because it is lack. And Fiji can answer this, because you have so many recipes, I am sure, with that increases the iron and the B12 for vegetarian people. But if vegan diet as a diet therapy, well, it is a fashion. It's a fat diet like any diet. You have to be balanced. It has to be not to take vegan for weight reduction, because it's not meant to be. So many vegans are very obese, and they have so many problems, cardiovascular, diabetes, and all of these things. So I don't advise it as a kind of a diet. But
Yeah.
Sort of, more than a
Yeah.
diet,
healthy.
I think it is the concept for these adolescents, and they get pulled into that concept. And I think you'll agree that it is a totally different industry now, world over.
Yeah,
Yes,
true.
it and then
Vegan
more than
food
that,
products.
Dr. Kalpana, it is the same like, you know, everybody is lactose free, everybody is gluten free.
Yeah. Oh my God, this is now. This is a fashion, and I hate it because it's not true. It's not true. Each one have to be, treated as she said. It is a fashion. It's
Yeah,
spread
yeah.
like everybody. I cannot take milk because lactose intolerance. I cannot take
Yes,
gluten because I have a bloating. Who told
yes,
you this? It is
yes.
really, it doesn't
But
happen like that.
sadly, even doctors say that.
True.
Sadly, I should take this
Yeah.
platform to say that, because many pediatricians and many doctors are in this platform, and we feel
Unless
very
he
bad
had gluten from the beginning, he had
unless they are
gluten.
celiac disease, unless it
Yes,
has been proven with a test, or they are on elimination diet, or they have been
that's
gone through proper nutritional assessment, and nobody else can judge them, you know, that they are lactose free with a small regurgitation or a reflux or a gastritis or
100%.
a single sleepless night of bloating. They declare themselves as they are lactose free and gluten free, and which I cannot agree. And I always have a very hard time when such people walks into my OPD. So,
Yeah,
Dr. Kalpana, if you give us the topic diet, me and Dr. Wafa will not stop.
yeah, true.
No
I
problem.
want
But
to
we need
interrupt here, Dr. Fiti. Dr. Kalpana, sorry, I want to interrupt. Many parents, they come to us when we give dietary advice. Parents say, our child is vegetarian. What do you advise for, to enhance the
There is no
food?
problem to be a vegetarian. There is no
Yes.
problem to be a vegetarian. There is no harm. But the problem is that how are you going to balance it? How much is your protein allowance from your lentils and pulses? How much
Yeah.
of milk and dairy products you are going to take to compensate the other nutrients? And are you going to have enough vegetables along with that? How much is the carbohydrate from your roots and tubers and grains and all other carbohydrate sources you are going to take? They don't have much idea about that. They will just say vegan means it's only the potatoes and rice and sabji. No, there are lots of lentils. There are good nutrients. They are all protein rich: sprouts, pulses, soya beans, tofu, paneer. But you have to put that into a proper proportion. Then only you will be having a proper nutrients. Otherwise, what will happen? They will have more carbohydrate, and to just for a garnish, they will have some vegetable. They will be lacking in protein. But instead, if they have a good portion of proteins with vegetables and carbohydrate, it's balanced. There is no harm.
Thank you.
And there's another question regarding keto diet.
Oh my God. Keto diet in a pediatric nutrition, very sad. During my post-graduation days, I have done keto diet for epilepsy patient, you know, the severe convulsion
It is meant to
patients.
be for
Yes.
them. It is meant
Yes.
to be
Not,
for them.
yes, not
Yes.
for any other population. I won't
Yes.
recommend, and I always have argument with even my colleague doctors in the hospital also, but I don't have any hesitation to say that even in this platform, that be on a balanced diet. Why you are behind any or going forward with any of the fat diet? You eat your food, what you like. Be in the balance, be in the normal and natural products or natural sources of the food, and eat happily. Sleep. Are you sleeping 8 hours when you are eating or going
Drinking
for this fat
water,
diets?
exercising.
No time with DPC webinars.
The problem that keto, they will reduce fast, but they will pick up more than what they have reduced. Plus, so much harm in triglyceride and in the lipid profile in general. So no, and
No.
big no for that.
Big
Unless
no,
it
big
is
no.
required for epilepsy, no.
Final
Because
question, not
one question I have,
children.
I want to interrupt, because before that, all the panels, especially Dr. Naik, we see a lot of children hyperactive and behavioral disorder. There was a
Yes.
platform, there was an argument. I am in favor. Now I would like to know the role of nutrition for these children, hyperactive, because we see many.
Yes.
And parents in that, I am in favor of, things like zinc, omega-3, other? What is the
Selenium,
latest
you can add
evidence
selenium.
and this?
There's a lot of things for those patients that you can add. Selenium, certain vitamins and minerals can really impact them. Plus
But
a lot of studies, which is, you know, again, it's individualized. Some of them casein free, some of them gluten free, some of them, it depends on the patients, and it's a trial. By end, it is individualized, and we have to try with the patient to see where we will reach with this child, or to which state, what makes them calm, what makes them better, what makes their activities less, what can make, it is tailored. We cannot just say this diet goes with everybody. Never. There's nothing one fits all. It have to be tailored.
But there is one thing, excess calories from the sugary and fizzy drinks, they are always hyperactive. I have seen even with my OPD patients, when I reduce this fizzy drinks and the excess calorie rich donuts in their excess intake. I'm not saying that they cannot have that, but if they're having it every day, cakes, pastries, ice creams every day, yes, they are prone to hyperactiveness, and they are seen that when it has been reduced in good portions.
It's empty calories make them crazy.
Yeah.
Dr. David, your opinion.
I would also look at processed foods and food chemicals, because the food additives tend to be an issue, and the processed foods tend to have not much real nutrition also. So that becomes a problem as well.
Yes, yes, agree.
Agree.
The role of zinc and omega-3.
Omega-3 is excellent and very much recommended, by the way.
Yes.
No, I'm writing because there was a controversy. That is why we want to I mean.
No, you can give omega-3 and it is recommended. It is very good for the brain and for the neurotransmitters. This itself needs one topic to talk about.
But it should be with a balanced diet. It alone will not do any magic.
No, true. Thank you.
Dr. Kalpana, please.
Yeah, I think, well, it is Dr. Fiji's last statement sums it all, and I'm happy with that. So thanks to Dr. Neil, Dr. Wafa, Dr. Fiji. It was a very stimulating session. Maybe we'll have more specific topics in the future.
I'm sure it is more nutritious.
Yes.
I would like to thank Dr. Levin, Dr. Wafa, Dr. Fiji.
Thank you.
Thank you.
Kalpana,
Thank you, sir.
Dr. Diagi, for this excellent discussion. I would like to thank all viewers. Still 400 are following us.
Thank you. Thank you, audience.
Thank you very much. Really, I learned myself many things. Thank you. I would like to thank Tawfiq and his team now for sponsoring this webinar. Thank you very much and good night.
Thank you all. Good night.
Thank you.
Good night.